Well, we went from men to menopause with Dr. Mona Gahara and Kavita Marawala, who are like two besties from Yale.
I learned a lot about those two. They have 5 boys between them. 5 boys. Oh, you got to be kidding me. And then Kavita is on the phone, which she's got a kid doing an interview at school. She's on her phone doing the podcast in her car. Like, I know, it's so typical. I loved it though. And it was great. I mean, Kavita said she went through menopause very quickly because she had a bout with cancer, and that was what tripped her very quickly into menopause. But everybody is talking about it now and wanting to know what products are really the most beneficial. And it was sort of interesting because we touched on the hot topic of topical estrogen. And I think both of them sort of felt like, has a place probably, but we don't maybe know enough right now. And we don't probably have the right forms. And we don't, know about systemic absorption. And they were still very high on their retinol. Mm-hmm. And, they talked all about retinols and how easy they are to use and how important they are and how they affect all the layers of the skin. You get epidermal effects and dermal effects. And of course, obviously it's what's in the dermis that really makes the wrinkles and the things that we hate go away, but it's important to lighten hyperpigmentation and things like that. A lot of patients on HRT get melasma. Mm-hmm. So just and also they both talked about skin of color patients. And they said they feel very comfortable using the Neutrogena rapid wrinkle repair products in patients with darker skin types. I'll never forget. You never forget the things that go bad in your practice. And I remember I treated a girl with skin type 5 with a prescription retinoid once. And when she came back irritated with PIH, she was mad at me, mad as a hornet. And I really did not prepare her properly for how to start it. And, I probably just gave her the prescription and off she went. But they said they feel very comfortable with these stabilized, slow delivery, bioavailable, low concentration retinols, which is basically what you get with that rapid wrinkle repair product.
I was so happy you guys mentioned rapid wrinkle repair and went through that because that's one of my fave
Me too.
retinoids, Me OTC.
Too. I use it. That's what I use.
Yeah, it's great. And it's easy to get. Me. And you can use it underneath your eyes as well. I found it super tolerable for all areas of the face.
Yep.
And again, super accessible also. I thought you guys got into sunscreen use as well. And Mona said, you need to have the anti-Tinder relationship with your sunscreen.
They were hilarious. I was laughing the whole time. The anti-Tinder. Yeah, you got to love it. I also we talked about aging turning points, and I would have loved that study to go a little longer, like if I had my wish list, because there is something that happens in this perimenopause, which is actually right after the 35-year-old group. You start getting in the mid-40s, and that's when you start really going through perimenopause. And there is some incredible aging that occurs at that time. We know you start losing collagen precipitously in that time frame, and especially postmenopausal. And that's when women really come in there like, wow, something is really happening now. And that's when the intervention, you hope that you were collagen banking in your 30s so that you're not trying to play catch up, which is, I think, exactly what one of them said when you're in your 50s. So that's also another great reason to be using good products when you're young.
I just appreciated the fact that you had 2 brilliant dermatologists, both trained at Yale, like absolutely brilliant people who are both going through, or unfortunately Kavita went through menopause quickly, but going through the process and are able to kind of experience and commiserate with their patients and talk about their experience and how it's changed their skin and their bodies and their minds. And yet they still focus on the retinol. I mean, this is an age where we are, approached every day with a new regenerative product, a new type of exosome, and a new, brand new peptide, a new growth factor. I mean, literally on the daily, Patti and I are approached by a skincare company with something brand new. And some of them are going to work out great. Some of them are not. But the fact that they still rely as a foundational backbone to rejuvenating regimen as to retinol just goes to show sometimes these foundational ingredients are not going to go away despite all these new things that are coming. And I think we can just hang our hat on all the data behind retinol and tretinoin.